Hello, this is Dr. Paul. Welcome you back to the third and the final installment of Know Your Numbers. By now, you're weighing yourself, you know your blood pressure, you know your heart rate. Today, we're going to show you how to keep track of the healthy organs that you have and make sure that once a year, they are continue to be normal. So the first blood works that I think you should check once a year is called Basic Metabolic Panel. And that gives you a potassium and a creatinine, which follows your kidney health. If it is abnormal, I would not freak out yet because most of the time it's because you're not drinking enough water. Start getting eight ounces of water every day on top of everything else you're drinking and have a recheck, and it's probably going to be normal. If you have long-term blood pressure problems, you're diabetic for a long time, then the kidneys may be damaged and you may need to see a specialist to have that followed and corrected. The next blood works is a blood count, of which it will tell you whether you're anemic or not. Now, just because you're anemic does not mean you run out and get iron supplementation like the rest of your friends will tell you. You have to know where your blood is going. You might be losing it because you have a silent ulcer in your stomach and esophagus. You might be losing through the colon, through polyps and colon cancers, and you got to ask yourself whether you had a colonoscopy. Or you're not making it at all. Your bones are not making it because you're chronically ill or your kidneys are not working. So there are many reasons why you turn anemic, not just iron deficiency. So do you understand that? Next labs I want you to check is just a plain sugar. Well, normal is less than 100 before you eat and less than 180 after you eat. What happens after halftime? Well, most of us after halftime, 50% of us will have an abnormally high sugar, and 20% of us actually have frank diabetes. And so diabetes is a bad actor. It causes blindness, heart attacks, strokes, and kidney failure. So you don't want that. So please have that checked. The next lab is cholesterol. Normal is less than 180. And if you ignore it, if it's too high, then it causes strokes and heart attacks. What happened after halftime? Well, cholesterol tends to go up. Okay, it has nothing to do with a poor diet. It could be that we get older. It could be that we're less active. It could be because we're gaining some weight and we have more inflammation in our bodies. And that causes your liver to make more cholesterol, regardless of whether you're eating cholesterol or not in your diet. So do you understand that and have it checked and correct it if it's abnormal. Now, I'm going to finish this with the vitamin levels that is important for your health. One vitamin is vitamin D, which is a bone health, immune system health, and a brain function vitamin. It's very important. And if it's abnormal, you should probably start with 1,000 international units of vitamin D a day. And more is not better. I have patients taking 5,000, 10,000. No. Too high of vitamin D actually causes brittle bone disease. It causes fractures. So do check the level and correct it slowly and try not to take extra. The next vitamin, which is more important, is B12. As we get older, especially after halftime, our stomach stops absorbing B12 in our food, and so the level will probably start dropping. We'll get forgetful, we get fatigued, our feet starts burning, and if it's low, we could start 1,000 sublingual or nasal spray or shots. Pills probably don't work for the same reason. We're not absorbing it no more. So do understand that. Next one that we strongly suggest you check once a year is a thyroid function called TSH. If your thyroid is low, i.e. not working, you get forgetful, you get fatigued, your feet might burn, you might gain weight, and you might get constipated. And so, but unfortunately, the thyroid function runs in a very, very narrow range. And so going over the counter and buy thyroid or taking animal thyroid cause the function in your body to fluctuate from too high to too low all the time, and that causes your body not to feel good. And in fact, it gets worse. So human thyroid replacement is important, and your doctor has to check it every 4 to 6 months to make sure that you are getting enough and not overdoing it. So the favorite quote that I have from my patient is, if my insurance don't cover, I don't want it. And I want to warn you about all the stuff I talked to you about. It's okay to replace them and correct them, and you'll be fine. But if you waited and waited too long, then a lot of damages that I have related to you here is not reversible. At that point, it's too late. So in this case, an ounce of prevention is definitely worth a pound of cure. Thank you for your attention. And starting next week, we're going to dive into how to make you healthier with what we have to do together after halftime. Thank you very much.